Paul Edwards from the Governor's Office. We're glad you can join us for this afternoon's briefing. We'll hear today first from Governor Gary R. Herbert. He'll be followed by Senate President Stuart Adams and Speaker Brad Wilson. Following their presentation, we'll hear from Derek Miller, President and CEO of the Salt Lake Chamber. He'll be followed by Theresa Foxley, President and CEO of EDC Utah. And they'll all be able to be here to answer questions. They'll be talking today about the upcoming legislative session, the special session, and the release of Utah Leads Together, Volume 4. Following that presentation and question and answer, we'll then have our daily briefing from the Utah Department of Health from Dr. Angela Dunn, our state's epidemiologist. Governor Herbert.
Thank you, Paul. And again, welcome to everybody for our weekly briefing. We're honored to have you here, and thank you very much. As we reflect upon the current situation, we have here in the state of Utah and really around the country and around the world, this worldwide pandemic certainly has had its impact in a very negative way on our economy. As you know, I've called a special session for the legislature to convene, and the number one most foremost issue that they'll be addressing is the budget. How do we in fact balance the budget as we finish fiscal year 2020 at the end of this month, and in fact move into fiscal year 2021, which starts July 1st. And adjustments will need to be made because of the downturn in revenue that we thought we were going to receive, but because of the pandemic or not. I'm sure that's not a surprise to anybody. What I appreciate is here in Utah, how we work in a collaborative way with the legislature and develop consensus numbers, knowing how many dollars are really on the table for us, in fact, to divide up. And as we prioritize, what goes in this sector and what goes in that other sector, as we, in fact, represent the people of Utah in what I would consider a very fiscally sound, thoughtful, common sense way. Our consensus revenues that we have for 2020 and 2021 show that we have a deficit now of $93 million in one-time funding and a deficit of $757 million in ongoing funding in general and the education fund. And so again, I'm sure this is not a surprise to anybody who's been following what's taking place with this worldwide pandemic. It's economic chaos really throughout the world, and Utah certainly is not immune to that downturn, and we see that in the slowing of the revenue stream. Part of the responsibility we have of having a special session is to really do what needs to be done to accelerate the recovery of our state and return to more prosperous times. And we'll have President Adams and Speaker Wilson say a few words regarding that in just a couple of minutes regarding the special session. Let me talk about for just a minute, though, before I turn the time to them, regarding the COVID-19 related economic downturn. It has been deep, but not nearly as deep as it could have been. It's kind of like a good news, bad news. The bad news is we have lost a lot of revenue. The good news is it's not as bad as we thought it would be. In fact, we're in a much better shape than we thought. That doesn't make it any easier for those of the thousands of people who have had disruption in their lives. They're out of work, on unemployment, and their lives have been disrupted in a significant way. And we understand that and have empathy for those who are waiting to go back to work and are desirous of that. I think we have opportunity to be optimistic that we are on the road to recovery already. As has been mentioned here a couple of weeks ago, our unemployment rate was at 9.7%, which is at recession levels around the country here from 2008. So 9.7% is about 5 percentage points lower than the national average at 14.7. Now, we'll have new numbers coming out Friday, and I'm very optimistic of what we're going to find here as we have new numbers released. I think we'll have a reduction. I'm hopeful that we'll have a reduction from the 9.7% unemployment rate to some lower number. I think, again, as we try to predict the future, which is a little bit hard to do, but there's reason for us to be optimistic and hopeful as we move forward. And I hope that message is out there to the people of Utah as we start moving into this recovery mode, that we really are open for business, that we're going to rebound. Not only are we going to rebound, but I think we'll be stronger than ever before over the next year as we, in fact, have learned lessons from this difficult time and make us stronger and better prepared for the future as we, again, continue to lead the nation, having the best, most diverse economy in America. That message is really an important part of our plan. I can't probably overstate how important it is to have a plan. As we got into this downturn, this recession caused by the coronavirus pandemic, we've had the challenge of what do we do and where do we go and how do we navigate the troubled waters and get us to a safe haven of recovery. And today we're going to unveil a new plan. I have here the hot off the press, a copy of Utah Leads Together Volume 4. We had volumes 1, 2, and 3. Now we're on volume 4, which is going to help us understand how to get from here to there. And I'm pleased with the work of many people. Again, we've had some of the best and brightest people on all of our plans, whether they be in the medical field, the scientific field, data accumulation and analysis, our business minds, the private sector, the public sector, government, all working together in concert to come up with a plan to help us lead out of this difficult economic downturn with the simultaneous goal of protecting people's lives, protecting the health and welfare of the people we represent, and also protecting their livelihoods to make sure that we have economic recovery as quickly as we can. And we've had, I think, great success in that regard. Let me just review, again, we've got volume 4 that we're putting out today, but our first volume was the economic phases we introduced of urgency, which we were in before, then stabilization, which we are in now, and recovery, which we're moving into. In the Utah Leads Together Volume 2, we introduced color-coded health guidance. We had the red, orange, yellow, and green. Those data tools have helped us manage us through the pandemic. We had Volume 3, which was released here not too long ago, which presented critical infrastructure for high-risk populations with more of an emphasis on those who were in the high-risk categories to target them to help protect them, as they seem to be more vulnerable to the coronavirus than the rest of the population, and discuss the impact that the virus has had on our multicultural communities out there that seem to be harder hit than the rest of the population of the state. I'm certainly convinced that because we have a plan and we follow the plan without deviation, really, it's been a dynamic plan which expands and reflects the needs of the day and the new information that comes to us as we're kind of learning as we go under this challenging time. We've had better success than most any other state in America because of our efforts on having a plan. This latest version lays out the foundation for recovery. That's the essence of Volume 4 here. It has us consider what is the most important things. What are our priorities that we need to take on as a responsibility over the next 100 days, the next 250 days, and the next 500 days. Our immediate need, of course, is for Utahns who are out of work right now, which is over about 100,000 people, that we get them back to work as soon as is possible. This plan also emphasizes some investments in different areas. Number one is in construction-ready infrastructure projects, which have a multiplier effect to the economy. So it's helpful for us to, again, as a catalyst to get the economy back and humming. It also allows us to, in fact, prepare for the future by having the infrastructure needs that we need to have in place to accommodate growth and prosperity, which we believe will come back to us once again as we've led the nation this last decade. Many of the recommendations are going to be part of this Volume 4, which include targeted assistance programs that are funded by the CARES Act coming out of Washington, D.C. Some of those issues will be on the call tomorrow in our special session. Central to Volume 4, though, and I can't overemphasize this enough, is the imperative that Utahns continue to take personal responsibility on the directions that are being asked of them. In fact, public health guidance, proper hygiene, social distancing, washing of the hands, wearing of a face mask, If we're going to have success on this, it really comes down to each one of us as individuals to follow these guidelines. If we do so, we're going to slow the spread of this coronavirus and stop it and be able to open up quicker the economy of Utah. So again, we appreciate those who've put this Volume 4 together. Let me just mention a couple of them. Derek Miller has been a part of this, leading this effort as the Salt Lake Chamber of Commerce president, former head of GOED, the Governor's Office of Economic Development here in the state of Utah, really understands the business needs of our state as well as about anybody. That effort's been co-chaired. Our Economic Recovery Task Force has been co-chaired along with Derek with Theresa Foxley, the president CEO of EDC Utah. Again, the private sector organization to help us incent and get private sector opportunities to grow the economy. Also here with us is Ben Hart, who's the Deputy Director of the Governor's Office of Economic Development, who's also helped in putting this volume together. I know that also Chris Cox and Phil Dean from our Office of Management and Budget are data analysts, people who understand the budget very well and the dollars and cents and what it means here to our economy. They've played instrumental roles in the production of these plans. And last but not least, Natalie Gardner, I'd want to personally thank, who's the director of the Chem C. Gardner Policy Institute at the University of Utah, who's been really the orchestrator of all these efforts for these 4 volumes to get it done and help us have a plan of how to navigate troubled waters that get us, in fact, out of the difficulties we face now into a better environment for not only health and welfare of our people, but also for a healthy economy as we grow our economy back to the prosperity that we had and enjoyed by the first year. I'm just a remark in my own mind as I think about it. You know, we've been involved in this for about 3.5 months. That's really kind of a relatively short time when we've actually had the pandemic hit us here in the state of Utah and the economic collapse has been caused by that. I know for a lot of us it seems like it's been 3 years, and it really has just been 3.5 months. So we're doing good things. I'm very optimistic and hopeful about the future. The special session is going to help us, so I'll turn some time over to President Adams right now.
Thank you, Governor, and I'd like to add my thanks to all those who've worked so hard as we've dealt with this pandemic. But one of the things we've had to deal with, and maybe some of you remember, back in April, they moved the filing date for our tax returns, and that got moved to July 15th. So with that, we need to take care of those budget items, those things that cause us to have our revenue reduced, and actually deal with some of the structural items, because we're going to balance our budget June 30th. We do it every year, and we're going to do it again this year. So thanks again for calling us into special session, because that's what we're going to take care of in the next couple of days. It's great to live in Utah. We talked about budget cuts, and we've talked about having to cut education and social services and all the other budgets. But today, tomorrow, as we're unveiling our budget and executive appropriations as they meet, actually social services will not be cut. It'll actually be increased by almost 6% with Medicaid increases. Education, we'll see with the growth money that we actually appropriated last December, it'll actually increase over 2%. We're increasing the WPU, the weighted pupil unit, the money that goes for each student that is in each classroom will increase 1.8%. So those increases, I think, are great things because we live in Utah and we managed our affairs well. Other budgets may be cut by 2 to 3%, and we'll stop buildings. We've gone up and borrowed money. We prepared for this day extremely well. We have what we call working rainy day fund. And that is that we haven't spent all our ongoing money on ongoing expenses. We've taken ongoing money over the years and spent it on one-time expenses, buildings, roads, other things that we only spend once. So then we can take that money that we would have spent on building and roads, we can stop those buildings, stop building those roads, or we can bond for them, bring that ongoing money back and do the type of increases that we're doing here. I think we may be one of the only states with dealing with COVID, this virus, that we're actually increasing budgets for education and for social services. One of the things Utah's always done is we valued education. Some people say we're the lowest in the country per pupil spending. That's right. But one thing we are is we've always been in the top 10% as a percent of our state budget for education. 50% or more than our budget goes to education. And that's really something I'm proud of. Again, we're trying to maintain our commitment to education spending this year. One other thing, a statistic that I think we ought to be aware of as we deal with the pandemic is we need to do it in a holistic way. We've looked at March and April fatalities in 2019 and looked at March and April fatalities for 2020. The increase in fatalities for those 2 months is 164 additional fatalities. During those 2 months, we had 50 COVID fatalities. As we look at those, I'm really concerned that as we have a third of the increase of fatalities for COVID and 2/3 for other fatalities, that perhaps some people are hesitating getting their preventative medical care. We're seeing additional visits to hospitals in the emergency room that are actually being admitted to the hospitals. Hospital and healthcare visits are down, but the severity of those visits are up. And we're concerned that those, at least I'm concerned that those increases may be attributed to those increased fatalities. We can get through this together. We're going to do it together. A lot of great work. We're legislation that we're working on. You're going to hear Speaker Wilson's going to come in and talk about some of the great things we're doing economically to keep the state going. Appreciate being here. Governor, appreciate your great work.
Thank you, Governor. Thank you, President Adams. It's great to be with you today. 2020, I think all of us recognize, has been unlike any year that we've experienced. Interesting is a word that was used yesterday in a conversation. We've faced significant challenges from our health perspective as well as economically, and in Utah's societal changes that we've dealt with. I've been really impressed, I think all of us have, with the way the citizens of the state of Utah have adapted to the changes that we've needed to implement this year and the changing circumstances that are around us. You all, Utahns, have successfully flattened the curve. We've managed hospitalizations well in this state, and now the state is well positioned to take advantage and get our economy growing again. The Utah Leads Together plan that's being updated today outlines the next phases of our coordinated effort to do three important things. The first is return to work while following the public health guidelines we've discussed. The second pillar of this transition today is to connect unemployed Utahns with available jobs. And lastly, to start to utilize $50 million or more of the Federal CARES Act money to encourage consumers to re-engage in the local economy. The Utah Leads Together 4.0 plan lays out 100, 250, and 500-day horizon plans to encourage the economic recovery of our state. As part of the plan, over the next 100 days, the Utah Department of Workforce Services is going to be charged with working with unemployed Utahns to align worker skills with available jobs and providing employment for over 21,000 Utahns through a bill we'll be discussing over the next couple of days. As you're also aware, over the next couple of days, we've been called into special session to deal with budgetary and policy items related to COVID-19. One of the bills that I'm excited for us to be talking about and pass later this week, hopefully, is the COVID-19 Economic Recovery Grant Program. This bill will set up a framework to use over $50 million from the CARES Act to take revenue and help support targeted businesses that were most affected by the pandemic and encourage consumers to re-engage back in the economy as outlined in this version of the Utah Leads Together plan. This bill from Representative Spenlove and Senator Herbert creates the following grant programs: the Utah Shops Together, Utah Creates Together, Utah Works Together, Utah Innovates Together, and Utah Stays Healthy Together. The Economic Recovery Grant Program is a set of grants that will go directly to the businesses and organizations that have been affected the most with this pandemic. The grants are going to go directly to businesses with a requirement and an expectation that these businesses and organizations partner with the citizens of the state of Utah and gives back to our citizens. These CARES funds must be spent by the end of the year, and we believe it's important to get this money working in the economy and working quickly. We can think of no better way to get the Utah economy moving to the place that we know it deserves and has been number one in the country by using some of these CARES funds to directly help and support Utah businesses. In the 250-day plan, we're going to focus on the key foundations of economic growth of our state, investment and productivity. To do this, we want to put our state's excellent credit rating to work, to take advantage of where we're at as a state and to invest in our communities. Think about bonding for transit or roads or water or transportation infrastructure and other projects that are going to help us meet not just our current economic needs, but also how do we invest in the future growth and prosperity of the state of Utah. The legislature, along with the governor, will begin working on potential bonding proposals that we can talk about for shovel-ready projects to help move the economy forward. And as we look past 250 days to a 500-day time horizon, we have the opportunity, we think, to set a new path and redefine Utah's economy and create a new normal for the state of Utah. We need to focus on big investments that move the economy in significant ways and capitalize on Utah's incredibly talented citizens and the competitiveness of our great businesses. I'm proud to be here today as we announce not just baby steps, but big steps in leading Utah together. I appreciate the governor's leadership, that of President Adams, and we have very important and big work ahead for the state of Utah and some difficult months probably ahead as we take care of those that have been affected by the pandemic. But I have confidence in where we're heading as a state, and I have confidence in the collective commitment as we work together and keep our eye on Utah's long-term health and prosperity as we move forward. Thank you.
Good afternoon. I'm Derek Miller, President and CEO of the Salt Lake Chamber, and also serve as the chair of Utah's Economic Response Task Force. 3 months ago, with the creation of the task force, we turned our full attention to navigating Utah from the depths of the pandemic back to public and economic health. We assembled some of the brightest and most diverse minds across the state to bring Utah's intrinsic talent to bear against this challenge. From this broad group, we developed the Utah Leads Together plan that would provide Utahns hope and a serious playbook to chart the way back to prosperity. I want to thank the members of the task force and the hundreds of citizen volunteers who serve on our various committees. I also want to pay a special thanks to Theresa Foxley from EDC Utah, who you will hear from in just a moment, and Ben Hart from the Governor's Office of Economic Development, who led the effort on this most recent volume. And today we introduce that fourth volume, or Utah Leads Together 4.0. This has been a collective achievement that will go down in history as a monument to personal responsibility, self-governance, innovation, and leadership from many quarters. Utah Leads Together 4.0 fleshes out 3 structural components of a healthy and thriving state with benchmarks. These are 100, 250, and 500-day horizons that will guide our priorities and our activities. Let me briefly discuss the initial 100-day focus and what we expect to achieve. First, safety is integral throughout each component of the plan and must be central to all of our activities and efforts to catapult Utah back to the economic summit. As part of our return to work, the Stay Safe to Stay Open campaign was started with a focus on building business and consumer confidence. This campaign calls on Utah businesses to take a pledge to engage in the best practices for health and safety. Those businesses that take the pledge will receive signage for their businesses, and consumers who see the Stay Safe to Stay Open signs can have confidence that those businesses are following state health guidelines. The official Stay Safe to Stay Open website is launching next week, but businesses can begin today to prepare to take the pledge at stayopenutah.com. Second, our focus over the next 100 days is to return Utah to full employment. The bad news is we have many people on the unemployment rolls today, but the good news is that 77% of those individuals currently on the unemployment rolls are still attached to a job. Helping businesses to reopen safely is the best way to get people back to work. Since the vast majority of those currently unemployed are furloughed employees, our focus is on making sure those jobs survive and those employees can return quickly. We also need to focus over the next 100 days on helping those without immediate work prospects to connect with the many job openings in the state. We are fortunate that Utah had the fastest job growth rate in the nation when the pandemic hit. And because of that, our industries still have many available jobs. Third, getting Utahns back to work will require some economic restructuring. And during the first 100 days, we encourage the legislature to use some CARES Act funding to target key industries that need assistance. Targeted economic stimulus can help some of those most heavily impacted industries to recover more quickly. We will make this a time to help Utahns shop, create, innovate, work, and most importantly, stay healthy together. In conclusion, it is true that we are in the midst of an economic crisis, but we are also in the midst of an economic recovery and renewal, a renewal that we are collectively building together. The commitment of the Economic Response Task Force is that we will continue to lead together to support the great people and the great businesses of our state. Thank you.
Thank you, Derek. I appreciate the opportunity to join you, the Governor, President, and Speaker today to share more about the Utah Leads Together Volume 4 250-Day Horizon. It shares the guiding principles of the plan by proposing a mix of short-term construction-ready and long-term targeted investments that reflect where the global economy is headed. We start with tactical revitalization investments and move towards broader, more strategic investments that position Utah for long-term growth. In the 250-day horizon, the state begins to pivot away from stimulus and recovery to lay the groundwork for economic expansion through infrastructure and human capital investments. In the near term, we know that these infrastructure projects can have great multiplier effects in our economy, and in the long term, they facilitate economic expansion. The task force recommends accelerated bonding for infrastructure. And 6 areas of focus include transportation, such as new highway capacity construction, enhancing UDOT's existing telecommunications network, and expanding our network of electric vehicle charging stations as possible investments. Transit, bus rapid transit, front-runner double tracking in high-demand corridors, and capital facilities to speed up transit authorities' transition to natural gas and electric fleet are focus areas of the task force here. Active transportation and outdoor recreation. In this category, we recommend the state and local governments focus on projects that will increase quality of life in our urban communities and bring jobs to gateway communities. we may see a contemporary version of the Civilian Conservation Corps arise from this effort. Fourth, water quality and availability will undoubtedly influence our state in coming decades. Financing additional wastewater treatment and sewer facilities, pursuing dam safety projects for drinking water, and using grants to buy down the cost of using federal funds are possibilities here. Broadband is a fifth area of focus and can help address social inequities. We can narrow the digital divide through a UETN network buildout and state broadband grant program to expand last mile access. And six, in the area of housing, we know that Utah has a shortage of up to 50,000 units. State leaders may want to consider a housing bond and other policies to increase Utah's housing supply. Energy efficiency upgrades may be part of an overall housing strategy. Now let's talk a little bit about human capital. We are recommending that there be significant investments in training-ready investments for rapid reskilling and upskilling. While we expect a full economic recovery, we know and we understand that with major economic trends underway, Utah will be better poised to compete in the post-COVID economy if our human capital is well educated and well prepared. Accordingly, we are suggesting 4 major actions. 1, make strategic investments in short-term training programs designed to meet the immediate needs of key industries. 2, expand flexible apprenticeship programs that will fit the needs of businesses. 3, provide a voucher program to Utahns who want to attain post-high school certificates, credentials, and degrees. And 4, provide vouchers for 1-year graduate programs. The bottom line here is we should make reskilling faster, easier, and more affordable. Finally, this bridges us to the 500-day horizon. Utah's economic revitalization plan focuses on actions that can be taken in the next 500 days to ensure prosperity for the next 5,000 days. This part of the plan builds on our understanding of where the world economy is headed, but it does require further discussion with state and other important thought leaders. We need to focus on what infrastructure will be required to support mega trends in automation, machine learning, augmented reality, and cybersecurity. We also need to be prepared for new shifts that this pandemic has introduced, like shorter and smarter supply chains, remote work, food quality, food security, and air quality. By prioritizing these investment options that maximize societal benefit, by sharpening our focus on economic inclusion, by adopting a key sector strategy that's aligned with these megatrends and reimagining our economic development programs and incentives, we can achieve a higher trajectory of global leadership and growth. We look to partners across the state to help us identify new programs, new ideas, and new infrastructure investment opportunities to ensure that Utah's economic future is bright for all. Thank you.
Well, thank you. As we get ready to go to the Q&A portion of the program, I was just struck, President Adams just leaned over to me here and said, "Isn't it great to be in Utah? Isn't it great to be in Utah?" We see over this time of crisis, it's like cream rising to the top. Good people of goodwill throughout our state rising to say, what can I do to help? We know that the good people of Utah have had to sacrifice greatly in this pandemic crisis that we face, which is unlike anything we've ever seen in 100 years. It's like building a bus, as we've said, going down the freeway at 60 miles an hour, and not all the parts are fitting. But we're doing a pretty darn good job working together. I appreciate the wisdom and the leadership that we see in the legislature. We've never had a better time where we've had a spirit of cooperation and collaboration from the executive and legislative branches coming together and saying, what can we do? What do we need to do to find a way to get through this challenging time of uncertainty, where many times we haven't known what's around the next corner, but trying to find a way and have a plan. The old adage, those who fail to plan to fail, applies very much to what we've gone through. I appreciate the fact that we have not only a plan, but these are action plans, things and steps we can take, which help protect people's health the welfare of the communities that we live in, but also open up the opportunity for economic recovery and get us back on solid footing economically. Growing the economy is really, as we've always said, pays the bills. It doesn't matter what your issue is, education, social services, mental health, infrastructure needs. If you don't have a healthy economy, it's pretty tough to pay those bills. We've been very good at it in Utah this last decade of building and growing and expanding the economy to become the most healthy, diversified economy in the world. And we're going to do it again. We are going to have to go back and start over. We have a plan to get us there. And I appreciate the work of so many people, the leadership we see with Derek and Theresa and others who've been involved, saying, let's get together, let's put our best minds, our best thinking together and create an action plan of how we can go to work and get out of this challenge. Again, 100 days, 250 days, 500 days. We're not sitting back waiting. We're actually in the process of doing. And we see the results already with a healthier economy than most states in America today. And I'm here to promise you, we'll recover faster and stronger than any state in America as we follow the plans we've got outlined for us today. So with that, Speaker Wilson had to go back to a meeting. We've got President Adams here with me and Derek and Theresa. And so we'll open it up to questions right now.
Hello, Governor. It's Jason Wynn from ABC4 News. I have a question about the COVID-19 test. There was a complaint alleging that the co-diagnostic tests are not 100% reliable, and they referred to the FDA, stating that earlier on the last couple of months. My question is the state of Utah going to continue to use tests from Co-Diagnostics and Test Utah, or is there any type of testing being done to see if their tests are 100% reliable or at least 95% reliable when we're talking about COVID-19 tests in our state?
You know, we're constantly concerned about testing. As I've talked with other governors who've contacted me, and we've had discussions usually on a weekly basis. I just got off a call here today with the governors, a part of the National Governors Association. Testing continues to be a challenge. We want to test everybody, and we want to be able to have some assurity that we know whether they're infected or whether they're not infected. We have people that have symptoms, and then we have those that don't, called asymptomatic, and yet they still are able to spread the virus. I don't know of any test that's 100% accurate. I think most tests, they hope to be in the 90-95% accuracy rate. Sometimes you need to do them twice to make sure. I've been tested for the antibodies. I've done it twice just to increase the accuracy rate. I read a report from the Red Cross today that talking about what they're trying to do in testing, particularly antibody testing throughout the country. This is the American Red Cross. And they say they hope that their tests are accurate, but they know that there's some variance there, and it takes anywhere from 7 to 10 days to get the results back. So testing is a challenge. We're going to continue to work on it to improve it. We've had the private sector step up. We have RFPs now that are going to take place, and now that we're out of the emergency state of affairs, so we can go through a traditional RFP process on testing. And so we'll see maybe some new proposals and new opportunities to improve testing and improve the outcome accuracy rate.
So is our state going to continue to use the co-diagnostic information, given that there's a federal complaint against them right now?
Well, I think that, again, I'm not sure they're the same thing. Again, the complaint, as I understand it, and I'm not involved in that aspect of it, but here's what I understand. They're complaining, these are investors that bought stock in this company that they're alleging they were told it was 100% accurate, and they're only finding out it's 95% accurate. And therefore, they think that's caused them a loss of revenue or equity in their stock. I have no idea what that is, but if they're 95% accurate, that's pretty good compared to all the other tests that are available out there. So maybe not 100%, but 95% is pretty good, and we'll continue to work with anybody that's in that 90% ratio of accuracy, because I think it's hard to find anybody better than that. There's just variables that make it difficult to be 100% accurate. Next question.
Hi, Governor. Ben Winslow with Fox 13. Wanted to ask you about, obviously, this plan that the Utah Leads Together plan that you're unveiling right now, and accelerating economic recovery when we're seeing an increasing series of cases of COVID-19. Yesterday, the state epidemiologist told the legislature we were in an acceleration phase right now. And do you think that this is the time to do that when cases keep rising? And even though the speaker said we've flattened the curve, it does not appear we have.
Well, I know that Dr. Dunn talked about we're in an acceleration phase that I guess is kind of typical with pandemics, that we've had a flat rate, now we've had an acceleration rate. We've expected some of that to happen because of more abundant association. As we open up the economy, people are out of socializing with each other. We have in-house dining, for example. We've been open now for about 3 weeks to do that, and other kinds of events. It would probably just common sense say we might have an increase in infection rates. Infection rates are not the only criteria. Hospitalization capacity, our mortality rates, which are the lowest in the nation, at less than 1% right now. We have some good numbers out there too, but it does cause us concern and pause as we see this rate of infections go up. And what do we do about it? Actually, having a healthy community, protecting ourselves from the virus, and having a healthy recovery economically are not mutually exclusive ideas. In fact, they should be done together. We've said all along it's a false choice to say we can only do one and not the other. So I'm going to let Derek and Theresa maybe come in and comment on this Utah Leads Together Volume 4 and maybe augment to your question, Ben.
Thank you, Governor. As I mentioned in my remarks, but I'll repeat for emphasis, the very first item that we address in Utah Leads Together 4.0 in relation to the economic recovery is the fact that we cannot recover our economy unless we're also at the same time engaging in safe health practices. And so businesses and employers and employees can go find out more, not just at the coronavirus.utah.gov website, which of course we've mentioned many times, but also at the new website, which is stayopenutah.com, where they can find out about what a business can do to communicate to its employees as well as communicate to its consumers, and taking the pledge exactly what they're doing to adhere to those health guidelines that come from the State Department of Health.
First off, everybody wear your mask. We do know that in the first recommendation in the Utah Leads Together plan, as Derek referenced, is to return to work, follow public health guidelines. The task force recommends, and I hope that the legislature considers this, and I believe they may, making grants available for businesses to convert their space to being safer for welcoming employees and customers by providing grants for personal protective equipment, or what I like to call community protective equipment, making engineering control changes, signage, and other things to help safely bring patrons and employees back to work, while still considering that there are teleworking options and other ways to safely stay engaged in the economy. So, thank you.
Thank you, and Ben, I appreciate the question, but we know this virus doesn't treat everyone the same. If you're 18 to 30 years old and have no underlying health conditions, very improbable you're going to end up in the hospital. But if you're over 65 years old and you have but kidney disease, there's a 67% chance of you ending up in the hospital if you get COVID. We can open up the economy if we take care of the medically frail. We said it over and over and over again. And wearing a mask isn't necessarily to protect you. I've been tested positive for antibodies. I don't know when I had it. But if I wore a mask, I wouldn't be spreading it to those medically frail populations. So as we look at the increase in numbers, it's very important that they aren't the medically frail. If they're not, we're going to keep our fatality rates low, and we can open up the economy as this plan presents. So again, I'm calling it smart green, new normal, but we need to make sure that we keep our social distancing, like has been said today, wash our hands, wear our masks, and those that are medically frail, stay at home, stay safe, and we can get our economy going. Thank you.
Thank you, President. And again, you can hear us emphasize the importance of wearing a face mask. It is akin to wearing a seatbelt. There's no guarantee if you wear a seatbelt you won't get hurt in an accident, but it does reduce your risk. It makes the odds better for you. Same with wearing a mask. It'll help protect you against catching it from somebody else. It also helps you from spreading the virus, even if you're asymptomatic and don't know it, to somebody else. So for those that really care about their neighbors, you should wear a mask. There was a poll done here not too long ago that I saw in the paper just the other day that said 75% of the people of Utah believe if you wear a mask, it shows respect for your fellow man, a respect that you want to make sure that their health is taken care of. So all of us should wear the mask when we can't social distance. It'll take time for two more, and then we're going to run out of time. So 2 more questions.
Hi, Brady McCombs of the Associated Press. How does hospital capacity rates fit in with the other metrics you rely on to make decisions about reopening? And at what % does the capacity become a problem?
I didn't quite get that. So what about testing? Hospitalization.
Yeah. Governor, I was asking about hospital capacity rates.
Okay.
How does that metric fit in with the other ones you use to make decisions about reopening? And at what % does hospital capacity rate become problematic or worrisome?
Well, thank you. I understand now, Brady. And when we started out on this quest, we observed around the world and in other states that when the healthcare system is overwhelmed, people suffer and many die. So the number one goal was, in fact, to make sure that our healthcare system was not overwhelmed. Now, of their own volition, many hospitals stopped doing elective surgery in anticipation of saying we need to have capacity for those who have the COVID-19 virus. We can take care of them. Again, a lot of this was unknown. We hadn't done it before. There's nothing really to look at other than the experiences we saw in a few months of run up to us getting it here really in March. We mission accomplished on that. Our capacity is significant. Our number of hospitalizations right now is about 147 in ICU beds around the state. We're probably at about 15% capacity of total ICU beds in the state. So we have capacity there. We are concerned with the rising rates. If that translates into more hospitalization, we've got to be careful about that. And what will we do if things continue to rise? We need to reverse, going from yellow to orange or from green to yellow. That certainly is on the table. We would hope that doesn't happen. That's why we're trying to be very methodical and careful. It's not an on-off switch, as I've said many times. It's now we're off and now we're on. It's really a dial that we incrementally, in fact, adjust the dial to accommodate what the data tells us. So it's not just infection rates. You're right. It is, in fact, hospital capacity. The hospitals are going back with elective surgeries. They've been doing that for the last about 3 weeks. Their capacity of using the rooms now, some of them are up to 85% capacity and doing a lot more elective surgery. So I think we're in a good place. It's certainly something we watch and look at every day as we look at the numbers coming in and make evaluations on a weekly basis as far as what we should be doing in reaction to the data. Thank you for the question.
Hi, Governor. Tony Semerad with the Salt Lake Tribune. It was mentioned earlier this week that 4.0 would go part of the way towards addressing economic inequality in Utah. Can you highlight some portions of the plan that accomplish that goal?
Let me turn that to our experts and put it together. Theresa and Derek.
Thanks for the question, Tony. And you'll note that the cover letter recognizes that we're in a totally different time period now, with our collective attention being on economic inequities as we grapple with this issue both in our state and throughout the country. There are a number of different sections of the plan that talk about economic equity and inclusion, starting with, of course, education programs. We talk a lot about the digital divide and ways that we can close that gap through making broadband more accessible and available for telework, telemedicine, and telehealth. And in the final section of the plan, we talk about sharpening the state's focus on economic inclusion, and we adopt a number of the recommendations proposed by the Multicultural Commission of the Governor's Economic Task Force. Lots of work to still be done, but some great foundations laid here through Volume 4 of the plan.
Let me just add to what she said. I just got off the phone here just earlier this morning with former Speaker Paul Ryan. And he's now in the private sector doing work, but wanted to contact Utah. And his introduction to me was, how are things going in the great state of Utah? Which state has lifted more people out of poverty per capita than any state in America? We've been very good at lifting people out of poverty. Growing and expanding the economy, giving job opportunities, emphasis on education and skill training, giving our labor force opportunities to be the best they can be, and a free market system has not been lost on people outside of our state looking and saying, wow, Utah really knows how to do it right. We are concerned about income equality, at least income opportunity for everybody. And we've put together a multicultural commission to take a look at this very thing, as they've been disproportionately impacted through this coronavirus pandemic. We won't rest until everybody has the opportunity to have skills that line up with the demands of the marketplace and get themselves a good paying job. There is no limit in America, certainly no limit in Utah to being the best you can be. There are barriers out there. We want to find out what they are and eliminate them. But our goal is to make sure that everybody has an opportunity to, in fact, expand their opportunities and horizon, have an opportunity to not only leave something for themselves, their children, or their grandchildren, but provide a better opportunity for those who come after them to succeed in our very free market system here in Utah. That's our goal, that's our quest, and that's part of what we're going to be able to do to get back on track and overcoming this coronavirus pandemic. Our best days are ahead of us. We're going to be stronger and better than ever before. I'm hopeful, I'm optimistic. Again, with the spirit of collaboration, the leadership we see out there, we cannot fail. Thank you very much.
Right, good afternoon. So we now have 15,344 cases of COVID-19 identified in Utah. That is an increase of 407 from yesterday. We've tested nearly 280,000 Utahns for COVID-19. That's an increase of 2,992 from yesterday. This past week, we've had an average percent positive of 7.9% of everyone tested. That's down from 10% the week before. A total of 1,102 Utahns have been hospitalized due to COVID-19, and 147 individuals are currently hospitalized due to COVID-19. We have had a total of 149 deaths. That's 4 additional deaths from yesterday. 3 of the individuals were Salt Lake County residents. All were between the ages of 65 and 84 years old. 1 was a long-term care facility resident, and the other 2 were hospitalized. The additional individual was between the ages of 45 and 64 years and had a history of comorbidities. So we've been seeing an increase in cases for the past 3 weeks, with over 200 daily new cases. The risk of being exposed to COVID-19 is higher than ever in Utah. So I'm urging you to limit your number of close contacts by practicing social distancing, wearing a face covering when you're in public places, practicing good hand hygiene, and staying home when you're ill, no matter how mild the symptoms. With that, I'll take some questions.
Yes, hi, Sydney Glenn with Fox 13 News. Today, the FDA revoked emergency use of the Chembio antibody test, which is a finger prick test that's been used at several different sites across the state of Utah. I wanted to get your reaction to that, and also if you believe anything should be done in terms of allowing these types of antibody testing to be done in Utah when they do cost money. I think it's about $80 a piece, and the FDA is now coming back and saying not to use those.
Yeah, so at the Department of Health, we work with all testing platforms that do have FDA approval through an EUA, and we respond to those results. So we respond to those with positive antibody results, positive PCR results, and there are some antigen testing out there as well. If a company or a platform doesn't have FDA approval, we don't use it for public health purposes.
would you encourage or discourage people from getting any sort of finger prick antibody testing after you see something like this come out?
Yeah, I think it's really important for people out there to understand how to interpret the results of any test they're getting, especially when it comes to new tests. We do have information on our website, coronavirus.utah.gov, specifically about antibody tests. So I encourage them to look at our website, but also talk with their healthcare providers so that they understand what their results mean.
Hi there. I wanted to ask about the 2 additional meat packing plants that were shut down because of COVID-19 cases amongst their employees. I'm wondering if, number one, I heard that they are in Draper and in Payson, if you could confirm that, and then as well as if we know how many cases from those total numbers are coming from those additional meat packing plants that were shut down.
Sure. So consistent with our past practices, we're not releasing the name of businesses or companies that have COVID-19 cases unless it's a threat to the health of the general public. So these 2 specific instances are contained with public health practices. I don't have the exact numbers off the top of my head, but they each had a handful of COVID-19 cases prior to taking public health steps to prevent additional spread.
Do we know if there's been any additional spread in COVID cases up at JBS, excuse me?
So we're actively working with JBS and the Bear River Health Department, in addition to the Centers for Disease Control and Prevention, to continue to prevent the spread of additional cases in that geographic area. We do know that cases have spread into the community there, and so it is kind of a larger scale outbreak response up there.
And then the last question I have with meat packing plant is, you have people who potentially have COVID-19 working with meat that becomes food. Is there a risk at all in spreading it that way, or is that not even a thing at this point?
Yeah, right now there's no evidence that COVID-19 can be passed through food, so we're not concerned about any of the food products being contaminated with COVID-19.
Hi, Dr. Dunn. It's Haley Hendricks with ABC4 News. 2 questions for you. My first is, I was looking at RT.live this morning, and our rate of transmission, it's showing around a 1.05. And last month when I talked to you, you told me that the goal is to get that rate less than 1. Yep. How does the state plan to get that rate of transmission down while continuing to reopen our economy?
Yeah, that's a great point. We definitely want the transmission rate less than 1. That indicates that we're decreasing our cases and having better control over the spread of COVID-19. And the messaging we've been doing from the beginning of this pandemic will help us get there. Social distancing, wearing face covering, using good hand hygiene, and staying home when you're ill are all ways that we know will prevent the spread of COVID-19 in our communities.
And can you tell me, what are we at about right now? Is that around a 1.05, or what are your guys' analytics looking like there?
Yeah, they're all around the 1.0 mark right now.
Okay, and then my second question to you is the health department considering stricter mask rules? I was looking at a new modeling study out of the United Kingdom that suggests that face masks may be even more important than we originally thought in preventing future outbreaks.
Yeah, so right now we're expecting that every Utahn out there wear face coverings when social distancing isn't possible. Right now we're not thinking of any stricter rules. It is just an expectation that people will do what's right and wear face coverings when it's needed.
Thank you.
Yeah, Dr. Dunn, can you hear me?
Yep.
Okay, Dr. Dunn, Ben Winslow with Fox 13. Just to be clear, we've seen an acceleration of cases. Have we flattened the curve?
Yeah, so right now we've seen an acceleration from about May 28th with our daily cases now reaching, in the 400s. So we're definitely seeing an increase in our growth rate and unfortunately have not yet had that plateau. Sure.
Thank you so much. And Dr. Dunn, this is Chris St. George's. And just to expand on that a little bit, for example, people will talk about, they always use the example of Japan. People there will respect people by by wearing masks, and they've managed to keep their COVID rate pretty low throughout. What you still have people out there who will even sneer at you if you're wearing a mask in public. What do you say to people who would say, this is not something that needs to be done, this is just hype, why should we wear masks?
I mean, just to echo what Governor Herbert was saying earlier, that wearing a mask really shows that you care about your community and that you want to prevent COVID-19 from spreading, especially to those who are at high risk for severe disease. So it is really important as we want to reopen the economy and make sure that our economic health is good, that we also take all the precautions necessary to protect our physical health, and mask wearing is one of those. Okay.
And just a quick follow-up. I mean, this is another one of those things I get by email, which is basically talking about, we unfortunately had another 4 deaths today statewide. And some people will say that any death is labeled as COVID these days. For example, someone gets into a car accident and they happen to have the virus, they'll say that it was their virus that caused their death, not the traffic accident. Can you speak to that?
Sure.
Is that a misnomer?
Yeah, it is. We follow a national case definition for determining when COVID-19 is the cause of death. So we take that very seriously, and we work with our clinicians and our Office of the Medical Examiner to ensure that every death that we're counting as a COVID-19 related death, that individual, if they didn't have COVID-19, would not have died. So every death that's counted is due to COVID-19. Okay, thank you so much. Have a good afternoon.